food that harms the liver. The liver is the largest external secretion gland in the body that continuously cleanses the blood of toxins, poisons, and allergens. This organ passes through and neutralizes alcohol, drugs, creates energy reserves, stores part of the blood, participates in the exchange of vitamins and hormones, and secretes bile for fat processing. Meanwhile, the liver can endure an incorrect human lifestyle for a long time without symptoms, experiencing colossal overloads and gradually losing functionality. Among the main non-infectious factors that lead to liver damage are regular alcohol consumption, uncontrolled intake of medications, a diet dominated by processed products devoid of plant fibers, rich in sugar and fats. There are about 200 million people worldwide with liver diseases, and these diseases are among the top 10 most common causes of death. The first and simplest step to avoid ending up in the WHO's sad statistics is proper nutrition, revising the diet. To maintain the stable functioning of the liver, a healthy person needs to simply refrain from large doses of alcohol and avoid products containing food additives. Most often, these are colorings, preservatives, flavor enhancers, trans fats, and carcinogens. Except for alcohol, all of the above are abundantly found in sweet carbonated drinks, fast food, snacks, chips, and store-bought sauces. The alternative is natural food that does not undergo industrial processing. Furthermore, it is important that the menu does not include fried and fatty foods. This does not mean that in the fight for a healthy liver, one must give up all delicious dishes and completely exclude animal fats and carbohydrates from the diet. You can eat everything in moderation, and when choosing products, it is important to adhere to simple rules, which will be discussed further. What kind of meat does the liver like? A healthy human body can properly digest any type of unprocessed meat. However, we recommend focusing on chicken, turkey, rabbit, and beef. Fatty types of meat such as lamb, pork, duck, and goose are more difficult to digest and impose a heavier load on the gastrointestinal tract. If the liver is already deceased, fatty meat should be excluded from the diet. For patients with liver cirrhosis, this rule applies for life. It is best for everyone, both healthy individuals and those with illnesses, to completely forget about processed foods, meat preserves, and smoked sausage products. These are carcinogenic products that even in small amounts increase the risk of oncology. Meat broth is equally harmful as it contains purine and nitrogenous bases that impair the liver cell's function. Byproducts such as liver, kidneys, heart, lungs, smoked sausage products, ham, bacon, and pancetta contain a lot of purines. To remove the most harmful of these purine bases, hypoxanthine, the meat should be boiled in pieces of no less than 100 grams for at least 5 minutes. The resulting broth is drained, and the meat is used to prepare goulash or beef stroganoff. When cutting meat, it is advisable to remove all visible fat, tendons, and films. Remember, the stomach digests steamed cutlets the easiest. Controlling sweet consumption. When the calorie content of the diet exceeds energy costs, carbohydrates become the cause of fat deposition in the liver tissue. Moreover, products mainly containing carbohydrates, such as biscuits and waffles, do not require bile acids for digestion. This means that the liver does not produce new portions of bile, and the existing volume thickens and turns into stones. Sweets containing simple carbohydrates such as sugar, glucose syrup, and maltodextrin sustain inflammation in the bile ducts, increase the proportion of cholesterol in the bile, and provoke a shift in pH. A healthy individual should try to limit the consumption of store-bought juices, desserts, quick-cooking breakfasts, and other easily digestible carbohydrates such as sugar and white flour. To mitigate the negative impact of these products on the liver, the calories obtained from them should be fully expended during the day, for example, through swimming or running. For individuals with obesity, diabetes, or metabolic syndrome, it is advisable to completely exclude the aforementioned products to avoid the risk of fatty liver degeneration. People with these conditions are recommended to consume products with dietary fibers, bran, whole grain flour, and natural sweeteners such as stevia and Jerusalem artichoke syrup. The harm and benefit of fats. In 2015, two influential medical associations in the UK, the National Obesity Forum and the Public Health Collaboration, published a report stating that the medical propaganda against fats in diets had caused colossal harm and had catastrophic consequences. The report did not emerge out of thin air, but was the consolidated result of numerous studies. Since the membrane of any cell, including liver cells, consists of lipids or fats by 30%, a sudden reduction in the proportion of fats in the diet would likely harm the body rather than reduce the risks of cardiovascular and other diseases associated with high levels of bad cholesterol. Therefore, doctors and dietitians now insist that fats should by no means be completely excluded from the diet. However, it is advisable to adhere to the following recommendations. Reduce the proportion of hard-to-melt fats such as lamb, beef, and pork in the diet. Avoid processed fats, primarily margarine. Use unrefined vegetable oils more often, such as olive, sunflower, flaxseed, and others. Do not fry, saute, or stew with fat. It is better to add a couple of tablespoons of butter or vegetable oil to already prepared dishes. Restrictions for people with liver diseases. For liver diseases, the following are prohibited: soups with fried meat, fried fish, mushroom broth, sauces and seasonings with mustard, pepper, horseradish, snacks, chips, pastries, cakes, donuts, chocolate, cocoa, spicy snacks, vegetable preserves with vinegar, marinades, pickles, fatty meats, canned foods, byproducts, semi-finished products, smoking, canned caviar, cod liver, alcohol, sweet carbonated drinks, strong tea, and coffee. It is important to limit legumes, beans, chickpeas, fresh and rye bread, puff and sweet pastry, cream, sour cream above 10% fat, spicy and salty cheese, sour and fatty cottage cheese above 9%, mushrooms, wheat and pearl barley porridge, and pasta in the diet. Products rich in essential oils such as garlic, onions, radishes, daikon, and spinach have an irritating effect on liver tissue. Fried eggs are more difficult to digest, so it is better to prefer scrambled and steamed omelettes. Diet features for liver diseases. The strictest restrictions in the diet are necessary for liver insufficiency, decompensated cirrhosis, and liver cancer. Such patients, in addition to the general recommendations, need to reduce the amount of animal protein in their diet, consume fewer meat products, fish, and milk. Vegetable proteins can be obtained from vegetables and cereals. In cases of progressing liver impairment, the overall fat content is also reduced. If fluid accumulates in the abdominal cavity, ascites, salt intake is reduced to 2 to 3 grams per day. A salt-free diet may be prescribed for 7 to 10 days. The amount of fluid intake is calculated based on the daily water excretion, typically including 1.2 to 1.5 liters of fluid, accounting for soups and beverages. During acute hepatitis and exacerbation of chronic conditions, frying, stewing, sautéing with fat, and products with coarse plant fiber should be avoided. After the patient's condition normalizes, it is recommended to follow the basic principles of a healthy diet. Prohibited items include alcoholic beverages, spicy snacks, spices, smoked and fried dishes. Other products should be cautiously reintroduced into the diet, monitoring their tolerance. How else to help the liver? Preserving a healthy liver is easiest through a balanced, moderate-calorie diet with an adequate amount of plant and animal-based products, and reasonable alcohol consumption. This approach often helps in preventing vascular and heart diseases, as well as metabolic disorders. In addition to dietary corrections, a doctor may prescribe the use of hepatoprotectors, drugs that protect the liver and gallbladder. Stay healthy, friends. Avoid illnesses and maintain a healthy lifestyle. It's the recipe for a long and happy life. If you enjoyed this video, please like and subscribe to the channel.